Here are some notes on enteric feeds in renal failure patients. Patients with renal failure need careful consideration when getting enteral feeds through an NG or OG tube. This is due to their compromised ability to regulate electrolytes and maintain homeostasis. There are a few things to consider. First, electrolyte management. Renal failure leads to impaired excretion of electrolytes, so they might have elevated phosphate, potassium, and magnesium levels. Standard enteral feeds can worsen these imbalances, so they make specialized feeds free of phosphate, potassium, and magnesium for this use case. There are also some considerations with calcium. Renal failure is associated with calcium imbalances, and they might need increased calcium intake through their feeds. You tend to have hypocalcemia in renal failure, partially because you're not activating your vitamin D and you're not able to absorb calcium as much as you normally would. You want to do regular monitoring to maintain appropriate levels of calcium, of course. Sodium balance, you might impair sodium balance in renal failure as well. Feeds must contain isotonic sodium concentrations, and this helps prevent further complications from sodium imbalances. There's an impact from dialysis. Dialysis affects your electrolyte concentrations, and again, you want close monitoring of electrolytes during and after your dialysis sessions, and you want to be able to react and maybe change your feed composition based on your dialysis schedule. Lastly, some notes on monitoring requirements. These patients need regular electrolyte panels, and they might need to adjust their feeds, as we said with the Dialysis Impact here.